The secret is you have to approach these patients with courage. Hi everyone, welcome back to my channel. Today we're going to be talking about how to deal with difficult patients. This is such an important topic because no matter how great of a nurse you are, you will have those patients that just make your job very hard. The bottom line is, it takes a lot of courage to face those patients that are mean, extremely rude, uncooperative, and sometimes just verbally or physically abusive. So today, I will be sharing with you 5 tips of how to practice courage in the place of fear and take great care of your patients that are really hard to deal with. So without further ado, let's jump right in. Number 1, practice courage by choosing to be empathetic instead of defending your pride, your ego, or acting out of fear. A huge virtue in nursing is empathy because it requires a great deal of care to really take care of people when they're at their low. And sometimes when people are at their low, they don't treat others nicely. I wish this wasn't always the case, but I can even relate to this. I know that sometimes when I'm feeling really sick or I'm just burnt out and exhausted, I'm not as open as I normally am. And that's not to offend the other person, but it's because I'm not feeling the best. So you, being a nurse, and you see what your patients go through. For example, some people have chronic conditions where they're constantly losing part of their health day by day. Just let that sink in, put yourself in their shoes, and imagine what that would feel like if that was your reality. No, seriously. Pause and think about it. I know it's really hard to sometimes put yourself last when it comes to how patients treat you. And in no way am I saying that you should allow a patient to abuse you or cross your boundaries or even pity them and just take bad behavior because you feel bad for them. But I really encourage you to treat your patients with dignity and respect and understand that they're going through a lot. Being in the hospital is a super stressful experience, not only for them, but for their families and their loved ones, their friends. And all of this, your patient has to take on for themselves. So we have to try our best to understand that there's a lot more under the surface of what that patient's portraying at that moment. And the truth is, we have no idea what they've gone through, but we can see them in their current condition, treat them with dignity and respect, and empathize with where they're coming from, or at least just try our best to. The next time you have a patient that's really hard to deal with, whatever problem they're causing, when you find that part of yourself that wants to react, I encourage you to try your best to just kind of quiet that voice down and just pause and look at your patient. And imagine how you would feel if you were in their shoes. It takes a lot of courage to put yourself last, especially when we know that nursing is a very hard job and sometimes you have to take time to yourself, but you get to be there for your patient and take good care of them when they're literally at their lowest points. It's one of the most beautiful things about your job. Alright, so number 2, practice courage by setting boundaries. There are situations where you have to be stern with your patients. Do not put up with physical, verbal, or sexual abuse from anyone. I just really believe there are certain things that shouldn't be tolerated, and if you have the voice to stand up to it and make it stop, do that. Be courageous. It can be very hard, but set boundaries for yourself out of respect for yourself and out of respect for your patient. You know that when you don't set these boundaries and you let somebody walk all over you, it completely alters the way that you'll take care of that patient. Instead of taking care of that patient out of respect and love and dignity, you'll be doing it out of fear, out of feeling like you have to take care of them. And these just leads to resentment, and you're not even thinking about your patient's condition, you're just thinking about yourself and probably how you're gonna make it through that shift. So yeah, you can politely but sternly ask them to stop. For example, you can say something like, I want to take good care of you. I'm here to help you today, but I will not tolerate sexual remarks. It makes me feel really uncomfortable and I'm asking you to stop. Chances are somewhere in your hospital's policy, there's like a patient code of conduct that will deem that type of behavior as being not okay at all. So if it needs to be escalated up the chain of command, and maybe even if you need to get security involved, that's totally okay, but be courageous in these situations and don't let your patients abuse you and walk all over you if you really feel unsafe. Now granted, there are situations where your patient may really just not know what they're doing. Like, I know I've had patients going through withdrawal and they are just cussing like crazy, or they're sometimes just, they have Alzheimer's and they're confused, and that's when you just have to keep your distance. I mean, you can tell them to stop, but if they're not mentally there, they might not. You just try your best to take care of them, keep your distance, and don't spend all of your time occupied with that patient because it's not worth it. Number 3, 3, this is in regards to those patients that are super uncooperative. Practice courage by exploring areas of resistance and by educating them. I don't know what it is, but especially my older patients, sometimes they just don't want to hear what you have to say. Like they don't want to work with you, and that's okay. But part of your role as a nurse is to make sure that your patients are making informed decisions. If your patient refuses treatment, they have every right to do that, but you have to teach them about why that treatment was chosen for them, how it's going to help them, and the risk involved in not doing it. Instead of taking no as a straight answer, ask open questions. You can say things like, okay, it seems like you're a little bit reserved about doing this. What are your concerns about the procedure? You can ask about their beliefs. You can ask, what has your experience with blank been? And this is all going to help you paint a picture of what that resistance is and help you get past it. Lots of the times patients don't cooperate, not because they really know what they're talking about, but it's out of misinformation or because they just don't know better and they need somebody who's going to take the time to walk through what's been planned for them. Always touch on safety and try your best to kind of show them how the hopes is to make them get better. Number 4, practice courage by taking an honest look at how you're feeling, your emotions, and throwing away the ones that do not serve you or your patient. I'm not gonna lie to you, not every part of your job is gonna be sunshine and butterflies. If anything, a lot of your job won't be. It's okay to connect with the human part of you that doesn't always want to do something or that sometimes can get really angry at patients or conditions or situations. The most important thing is to acknowledge that these feelings are there and to not let them affect how you take care of somebody or how you show up. Remember, you have to show up with empathy and treat these patients like you'd want to be treated yourself. So it can take courage to admit that you're having negative emotions and then to take it a step further and to actually just try your best to do the opposite of what you're feeling. This is so important because with dealing with difficult patients, it can be really easy to become resentful towards them and to defend your pride or your ego by not delivering the best care. But I really believe you can be the better person here by seeing the role that you have and choosing to treat it with honor and respect because you understand that that patient's reactions or what they're doing probably has nothing to do with you in the first place and you care about their healing overall. So our last and final tip, to practice courage by admitting your wrongs and choosing not to take them personally. Sometimes patients are difficult because of things that we've done, and honestly, they have the right to react if somebody that they trust in healthcare is maybe making their situation a little bit more challenging. I wish this wasn't the case, but sometimes there are mistakes in healthcare that can prolong a patient's stay. It can make them face things that they weren't really supposed to face, and by the grace of God, it doesn't cause harm, but it can definitely cause annoyance and frustration in an already frustrating situation. When you find that you're at fault at something, be courageous by admitting you're wrong. It takes a lot of courage to say sorry to a patient, and I'm not saying you should apologize for everything that your patient has to throw at you because lots of the times it won't be you, but when you can sincerely see that some action that you've made has impacted them in a bad way, take that on and just say, oh, I'm so sorry. Let me try my best to help you now. That, oh man, it shows that you care about the patient. And the truth is, not many people will do that because it's hard to put your pride aside and say sorry. But when you do, it usually kind of softens the patient's heart and they're like, oh, it's okay. Like they appreciate that you even just care enough to do that. So when you're in the wrong, don't take it personally and feel like you have to defend yourself. Just accept the responsibility and keep it moving. So I hope that you're gonna find these tips really useful as you apply them in your walk in nursing. The bottom line is you are blessed to be a nurse. You get to take care of patients when they're at their most vulnerable and low points. And with that, you're gonna probably face a lot of patients that are just not acting like themselves. But in their hurting, you have the power to bring healing through the way that you treat them. So I hope that this video is going to help you do that as you continue to go on in nursing, and I will see you guys next time.